Incompetent cervix.
The normal age of viability of the fetus is 20th to 24th week. Normally, the cervix should open during labor in full term.
It is observed on the second trimester.
Hello, we're here to discuss about premature cervical dilation, commonly known as incompetent cervix. In the second trimester, premature cervical dilation is evident. It is the inability of the cervix to handle the rising weight of the pregnancy. It arises when weak cervical tissue induces or helps to premature delivery or determination if a rather healthy pregnancy. The following are the features of an incompetent cervix. In terms of sensation, it is a painless cervix dilation in the absence of uterine contractions. The mother would feel nothing, making it inconspicuous. Its duration as early opening at 20th week or 5 months causes the baby's birth to be premature.
Moving on for the assessment, here are some risk factors to look out for while evaluating incompetent cervix. First symptom is bloody show, a pink-stained vaginal bleeding, increased pelvic pressure which causes low abdominal pressure and back pain, followed by rupture of the membrane. Uterine contractions begin, occurs approximately on the 20th week of pregnancy, urinary frequency causing pressure in the cervix, wetness to the sudden gush of fluid to the vagina, progressive dilatation of the cervix.
The following are the risk factors for incompetent cervix. Maternal age below 20 and above 35. Congenital structural defects. The mother already has this condition at birth. For example, the length of the cervix. If the cervix is too short, it will not keep closed. Any fetal movement will induce the cervix to open. Trauma to the cervix. Incompetent cervix can develop as a result of numerous surgical treatments aimed at repairing the cervix. Pap smear, for example, or surgical procedures such as dilatation and curettage. In rare situations, a previous cervical tear during labor and delivery may be linked to an incompetent cervix. Rupture of the membrane. Rupture of the membranes at the end of pregnancy or term can result from either natural weakening of the membranes or by the power of contractions, which then leads to preterm birth. Exposure to diethylstilbestrol or DES. Diethylstilbestrol or DES is a synthetic form of estrogen, transplacental carcinogen, or a cancer-causing agent that crosses the placenta. Exposure to this induces developmental defects and alters appropriate hormonal responses.
For the treatment, let's define first what is cervical cerclage. Cervical cerclage or cervix stitch is a surgical procedure in which a doctor will physically sew a woman's cervix shut to prevent it from opening. There are two types of cervical cerclage procedures. First is the McDonald cerclage. The cervical opening is cinched shut with common surgical stitching between 16 and 18 weeks, and the stitch is removed around week 35 to 37. The second type of cervical cerclage is the Shirokar cerclage. With this method, the stitching is done in the walls of the cervix rather than the opening. This is a more difficult procedure compared to the traditional McDonald method, but the deeper level of the sutures is believed to reduce the risk of infection. This is permanent and will be in for all future pregnancies. The doctors take a piece of fascia lata, which is like an elastic stocking, out of a woman's thigh and encircle the cervix with it.
For the nursing management, first, place the patient in Trendelenburg position to avoid expulsion of the baby and the pelvic part is elevated. Second, bed rest to prevent stress. Third, coitus temporarily restricted because it puts you at risk for miscarriage or preterm birth. Lastly, administer tocolytic drug on time to stop uterine contractions like rotodrine and terbutaline.
Summary. In conclusion, for us to not forget, let us take note of the acronym words for incompetent. I. Inability of the cervix to support the growing baby, wherein the cervix prematurely opens or dilate. N. No doubting. Nothing could try to enter in the vaginal opening, but you can wash the vagina with plain water without soap or chemical. C. Cervical circlage or the sewing of the cervix. It is classified into two known as McDonald and Sherrod-Carr. O. Occur at week 20 with pink bloody show. M. Maternal age. Congenital structural defects, the trauma of the cervix are common risk factors. P. Premature cervical dilatation, without uterine contraction, also known as incompetent cervix. E. Elevated pelvic pressure, causing low abdominal pain and back pain. T. The required position is modified Trendelenburg. N. No coitus temporarily, therefore sexual intercourse is prohibited. Tocolytic drug. It is given in case of uterine contraction like Ritodrin and terbutaline.